Hello, and a very warm welcome to everyone joining part 2 of this series of webinars on understanding behaviours and Fragile X syndrome. A reminder that part 1, in case you missed it, is available on the Fragile X Association website. My name is Liz Jewell and I work as the Family Support Counsellor with Fragile X Association Australia. Before we begin, I would like to acknowledge the traditional owners of this land and pay my respects to elders past, present and emerging. If any of the content in this webinar triggers you emotionally, please feel you can reach out to me personally directly after the webinar. A special thank you to Zynerba Pharmaceuticals for the educational grant and for making this 3-part series of webinars with Marcia Braden possible. And to our presenter today. Dr Marcia Braden is a clinical psychologist and special educator living in the US. Marcia is respected for her work internationally and presented at numerous conferences and workshops about Fragile X syndrome, autism, and other related disorders. In this webinar, Marcia will focus on explaining why traditional behaviour intervention often doesn't bring success in reducing difficult behaviours, and she carefully constructs a number of strategies to foster successful supports. Without further ado, I would like to hand over to Marcia.
Hello, everyone, and welcome to Behavior Part 2, which will look at intervention and strategies that are helpful with those individuals with Fragile X syndrome. And for those of you who are unable to join us 2 weeks ago, or those of you that are joining us and going through what we did before, I just want to review briefly what part 1 dealt with. We really set the stage in terms of the foundation for individuals with Fragile X, the things that interfere with their behavior and their compliance to the things that we would like them to do. So that foundation was developed, and today we're going to go back now and put in some interventions relying on that foundational piece that we talked about in part 1. What is behavior management? You know, people ask that question a lot, and I think it's actually pretty broad-based because there's a number of things that you could say about behavior management. But for me, and I think for this lecture, we need to look at a very unique way of managing behavior with individuals with Fragile X syndrome. And because of all the neurobiology that's brought into them on that gene, that Fragile X gene, we really need to pay attention to what that intervention looks like and that matches with the person with Fragile X. So we consider that phenotype, as we talked about before, and that creates the foundation for our processing and creating that sound intervention strategy. How do we manage those challenging behaviors? Very much in a way that I think we really put it together in a systematic process. And that's what I'm trying to teach you today, or to talk to you about today, that challenging behavior can really be managed, but we have to be systematic in terms of what we develop. We want to let those individuals with Fragile X access those opportunities to be included, don't we? And so many times I hear from parents, well, he's got the skills and he can work at this job, but he's had some behavioral episodes, and the manager is just saying he can't have him working there anymore. Even though most of the time he's complying and he's a very good worker, he's got those behavioral episodes that are causing him to say, I'm not safe here. I don't feel good with him working here. And so again, we want those opportunities to be included, and we know that we have to work on that behavior management in order for that to happen. So that sound behavior treatment is going to require a multidisciplinary team. And I think that in the States, at least, we look at that and include a whole team of advisors, so that when you're at school and you have speech therapists and OTs and school psychologists, or when you're in the work environment or in supported living, those individuals are part of the team as well. And those are the people that need to come together in order for us to really develop a sound behavior intervention. So what is it? Again, we really have to look at the tools that are out there for us. It's not just strictly the behavior management that would be like a written plan that we would develop and then, implement. There are medications that might be part of this. We really like to include a transdisciplinary team with a psychologist, a physician, and that physician or psychiatrist can be the person that sort of helps with that medication if in fact that's something that the individual with Fragile X is choosing to be involved with. I think a lot of times we tend to sort of think about putting someone on a medication and that's going to take care of the behavior. And so many of us, even good psychiatrists or physicians, will say, no, that's not all there is to it. We need to also have some support in terms of that environmental piece and the behavioral strategies that can be implemented. So again, with the speech therapist, with our physicians, with our teachers, with our psychologists, and the family, don't forget the family is a very integral part, then we can provide sound behavior management. We really want to look at the function. This is so important because we tend to spend a lot of time looking at the behavior, don't we? I mean, that's what gets our attention. But why is he behaving this way? What is the function of that behavior? And even though it could be maladaptive in nature, there is a function behind it. There's a reason. It gets that individual something. And again, it might even be as simple as sort of a timeout or being able to avoid something. And that's why they're engaging in that behavior. That's the function. So most of the time, the function is to respond to the phenotype or the neurobiology. And what I mean by that is if you have a sensory processing deficit and it's really hard for you to have lots of information coming to you at one time, visually, auditorily, tactily, there's going to be a real need to get out of that environment. That person is going to want to escape that very difficult situation or environment, aren't they? Because it's just too chaotic. It's too difficult to survive in that environment. And so what will they do? They're going to start to develop some behaviors that have the function of, I got to get out of here. That could mean I run away. That could mean I bite somebody and then I'm in trouble, so I have to be removed. It could mean that I'm very loud and noisy and I'm interrupting other things going on and I need to be removed. So again, those are the functions of those behaviors. It is a function to escape, to get away from something that's difficult or reacting to that phenotype. They also tell us what they need. Now, sometimes we miss that because what they're doing to communicate is something that's very aberrant, and we look at that as the behavior that we want to take away and change, but that's not really what it's about. What we really need to look at is that they're trying to tell us, I got to get out of here, or this is too noisy, I can't take it anymore. Those are the things that they will be doing. We have to pay attention to that because they can really tell us what they need. And another thing I really want to talk to everybody about today is that oftentimes we think something is going to be really, really great for these guys. We plan and we anticipate this great bash, and yet it really is overwhelming. It's something that is really hard for them to deal with. And it's really hard for us to deal with it because we have created a situation or an event that we think they're going to enjoy, and it's kind of our gift to them. And yet we're using our likes to establish some sort of an event where really to them, it's something that they don't enjoy at all. So we really have to look at that function and what's going on with that behavior. Now, the ABCs of behavior is something that's been around for many, many years, but it's still very tried and true. We see the antecedent, which is the action, and that is something that occurs directly before the behavior. When we study behavior, people will often say, there's no antecedent, it just comes out of nowhere. And sometimes I do agree with that, But I would say 90% of the time there is something that's happened beforehand. Now, it's not always directly before the behavior occurs. It could have been something that happened an hour ago. And we know that with these guys, don't we? Sometimes they hold it together, but they're thinking about something that happened maybe an hour ago, even maybe yesterday, that they're still upset about. And then there's a trigger, and all of a sudden, there's a problem with the behavior. So again, there's normally an antecedent. You just have to be really clever about looking back and figuring out what that is. The behavior is what we spend a lot of time and attention on, and then the consequence is what happens afterwards. And we often hear from leaders or people in management when people are working in a vocational setting that there has to be a consequence for that behavior. We can't just ignore it. And of course we can't. Of course we can't ignore it. And no one would want it to be ignored. But I think sometimes we go overboard on that consequence and we use so much of our energy trying to figure out what we can do to keep him from ever doing that again, that we've missed really the whole sequence of this functional assessment. So here's just a graphic on kind of looking at that. When we look at this, we realize that the antecedent really directs the behavior. In other words, this is the reason for the behavior. It can be a good thing, it can be a positive, and it can promote good behavior, right? It doesn't always have to be a negative, but it directs the behavior. And then this is what motivates the individual to either continue or to stop the behavior. So that's the consequence. So what is the function? This is interesting. If we look at these two pictures here, we can see that this little guy is crawling into two bean bags because he wants that pressure on his head and back and on his stomach. Now, it looks really very strange to us. It looks like he's doing something that probably isn't appropriate. He's in a preschool. I would probably agree with that. However, I would be looking at that very carefully and wondering, what's going on? Why is he doing that? Obvious is that he needs some sensory input, but why? That's the big question, because that will help us define the function. Why does he cover himself with something heavy? Well, because before that time, something went on that caused him to be hyper-aroused, caused him to be really sensory stimulated, and he needs to kind of get something to calm himself down. So he's going over to that beanbag and he's covering himself up with it. This guy is rolling himself up in a mattress in the gym. Now, most of the kids are doing wrestling, but he actually decided that this is what he needed. Very obvious why. It was noisy, it was loud in that gym. There were a lot of people in there. They were moving around, and wrestling looks to be quite a contact sport, and it sort of scared this guy. And so he went ahead and got the mat and rolled himself up in the mat, which to me is a lot more adaptive than some of the behaviors that I've seen him demonstrate in the past. So again, he's telling us, hey, I'm overloaded. This is what works for me. And since you're not helping me do it, I'm going to address it myself. Our job then is to look at that and to develop something that's more adaptive. One of the things that we talked earlier about was the consequence and the antecedent. Remember, we always had the antecedent first, but I think we really need to consider sometimes, as we said, that's the motivator, the consequence is the motivator. Sometimes our consequence may, in fact, increase the behavior. Let me give you an example. If an individual doesn't want to go into the cafeteria at school because it's very loud, people sit close together, and they have some issues with tactile sensitivity, the smells of all the food in there, because everybody has different food and different smells, is really difficult. Why wouldn't I act out before lunch took place so that the teacher would say, you can't go into the lunchroom because you need to stay here. Your behavior is such that It doesn't allow you the opportunity to go into the lunchroom to eat with the other students. Aha, he just got what he wanted, right? That worked beautifully. This consequence of staying in the classroom and being away from the large group has been exactly what he needed at the time. That's exactly what he went for, and that's why he acted out. Now, obviously, we would understand that hopefully from a couple of different experiences with him, and we would start to look at what kind of a behavior management system can we put in place so that he can, in fact, be comfortable in the environment where he is included. These are some triggers or antecedents for behavior problems. Again, we've talked about this so much, it's in the literature everywhere about the forced eye contact. And I think for the most part, my experience has been of late that people understand this, that educators, that people in the workforce understand that when you force eye contact, there's going to be something that happens as a result of that. And usually it's going to be an avoidance tactic. It might be just lowering their head, which looks disrespectful, which looks like they don't care about where they work and they don't want their job. But that's something that is very difficult for these individuals. If we're unclear in our expectations, it's going to be a trigger. Because for the most part, these people want to please. They want to do the right thing. They really want to be proud of what they do and to please us. And so when we give them unclear expectations, they oftentimes are very confused. And so instead of saying, I don't understand, and sometimes they don't have the language to say that, or this is a big one, I need help. I have been through this so many times with individuals with Fragile X. They will not ask for help. And again, I think it's part of this thing of, I want to please, I want to do it right, and I'm not sure what you're going to do when you help me. I don't know what that means. So again, unclear expectations, verbal instructions that aren't clear. It's sort of the same as the unclear expectations, but oftentimes we do not speak slow enough or enough to get the message across. The other piece is we always need a visual support, always, because we know that these individuals have difficulty with auditory processing, and oftentimes when they're anxious or they're shut down a little bit auditorily, that visual picture is going to allow them to go back and sort of resurrect what you've asked them to do. The consistency of routine, and again, this is at home, this is in the workplace, this is at school. It's so important. And you know, we might even say, oh, he knows his routine. And sometimes that's true. I have an individual that I see that will tell me his schedule. What are you going to do when you finish with me? He can tell me exactly what it is. But what works best for him is to see it in writing and to check it off, because then that really does resonate with him and it kind of calms him down and he knows what to expect. Noises, crowds, again, we think, oh gosh, this will be so much fun. We're going to take them into, a gymnasium and they're going to be playing basketball. We play basketball here. Very loud, echoes everywhere, lots of noise. And the other thing that's really difficult is people are moving all the time and they might be leaning up against you because they're getting up to cheer. Those things are so difficult for these guys with Fragile X. Transitions, we've talked about that many times, especially when it's going for something from something they love to something they don't like. It's very difficult to pull that off. And again, we have to be able to provide that intervention. Waiting without understanding why. Oh man, this is a big one. I can't tell you how many times parents will come into the office and their child is finished with me and they're standing over here and the parent is starting to talk to me and starting to talk about different things. And that child escalates immediately. And the adolescent, doesn't matter the age, because what does that get that individual? It gets an escape out because mom needs to leave now because he's becoming so loud and the behavior is not appropriate for the office, and so they leave. Instead, mom's saying, I have one question to ask Dr. Braden. Here it is. Finished, let's go. That expectation of time is so calming and so deliberate that it really does work in terms of an intervention strategy. When they're excited and they're emotional, then you're going to see obviously some problem behaviors. Here's the transition. We know that they have a stronger reaction to change in a schedule, personnel, or environment than those with ASD. I did it 100 years ago, it feels like, but my dissertation research bore that out. It was really, really interesting to see that when I compared checklists from parents with kids with Fragile X and parents with kids with ASD and no autism spectrum and no Fragile X, how different this looked. We would always think that, individuals with autism really have a hard time with change and transition, but it was significant, statistically significant in the group of those with Fragile X, that they had more trouble adjusting to that change in schedule, personnel, and in the environment. And I should add that the individuals with Fragile X do form relationships with their carers, with their teachers, with people in the community, don't they? And so when that personnel changes and we don't have a lot of time to sort of get them ready for that, and sometimes it's just not possible, it's really difficult for them. Then basically too, we have to, what this says is we need to have those protocols in place, and we need to have those consistent strategies in place, and the staff has to communicate frequently about those protocols with the data and the intervention efficacy. I also advocate introducing, if there's a change, with the question mark, which we really just teach as a skill, so that when they see the question mark, they know something is changing, something is different, and it can be taught in a contrived setting to start with, so that they can just learn what that question mark means. And so maybe it's you switch something around on purpose in his day that he's habituated, and you put the question mark up, and he knows something will change at that time. So it's a teaching format to start with, and then we can intersperse it into the day as things actually do change. So it's a day when there's a different supervisor coming in to supervise with the work environment. We can put that question mark up on the schedule of the day, and we do it at work as well as school or anywhere else. And that then can let them know there's a change in the schedule. Oh, I get this. I know what this means because we've practiced this before. Also, we use social stories, and that really does help with understanding changes in terms of what's going on. This is so interesting because this is a good video of how somebody is trying to avoid working on something with Tracy.
I just go like this, like that.
So, the Velcro background time?
Yeah, there's Velcro. Isn't that cool?
I never seen Velcro.
And you know what? Let's just do this first, okay? So I want you to try and do it so I can move these dogs. It's like a race.
Oh, so
Okay.
does brother get to do this yet?
Not yet. It's your job.
So put it up here.
Keep going. Let's move these dogs. All right.
So
Go too. Go.
It's going back now. I'll move it up back.
Okay. Go slow and careful, but not so slow that you're. That was
Awesome.
fantastic.
Sorry, 231.
Awesome.
You know what? You did that. You did it so quickly that I only had to record.
Good. So you can see what's going on. And what's easy, what happens for us parents and educators and therapists is that because they're so engaging, as this guy was, he almost got Tracy off to another track about the token board. So again, this has been reinforced, and we do this. I've done it before too, knowing that that's not the thing to do. But it's really interesting how that starts and gets reinforced, and so they continue to do it to avoid. This is an interesting one too, because this sort of shows you in action what a behavior chain is, and we'll explain that in just a minute. But this mom is reinforcing a behavior that we're trying to change in this individual as he comes into the office and he makes that transition from outside the car and mom to me. So there's hugs.
Great, right here.
He has to relinquish his device.
Okay. Good job, good job.
Now I have the token in my hand that he gets when he comes into the room and sits down and he's ready to work. So again, what's happened here is we've broken that behavioral chain, which normally is mom comes in with him, he brings in the device, he has a hassle with mom over that device, and it wastes part of our session. And so I just said, you know what, I think we need to use these tokens. He needs to and they're very reinforcing to him. You have to find something that's reinforcing, obviously. And he gets these tokens. I think this was a Batman token. But anyway, so he's going to earn 5 tokens, and then he gets to be with mom again. And we contrived it so that he only had to do a few things in my office with the door closed in the therapy room, and then he could go see mom. So I front loaded the token board so that he had immediate success and he could trust the system, so to speak. That broke the behavioral chain. The behavioral chain was, I'm coming into this office, I have my device, I'm going to keep my device. Mom then comes into the therapy room to get the device, and we're sort of fighting over the device, and we needed to break that chain. So this worked to do that. So what is a behavioral chain? This is kind of interesting. This guy, same guy, when he was a little bit younger, had to bring in all of these music devices in order for him to come into that therapy room where you saw him. The table is over here. And this all happened prior to him coming in and attending. So a behavioral chain is the pairing of a behavior with a response. This happens all the time, and we don't even know it's happening. So we create monsters because we respond to a behavior in a certain way. And these guys habituate that. They're real good at that because they are global sort of learners. They bring things together in a global perspective, not in this piece and that piece, but they learn something globally. So when I behave this way, mom does this. When I behave this way, Dr. Braden does this. Could be any of us, right? He will expect that same response whenever that behavior occurs. But what if we have somebody new on the job here who's going to be doing something different with him? Then we have a behavioral episode to contend with. And this is so subtle. This is something that sometimes we do just kind of to keep the peace, but other times we don't even realize that we're reinforcing a certain behavior by responding a certain way. And so if we continue with that, we just build that behavior. If we discontinue that response pattern, then we have a better likelihood of changing that behavior. It's a very interesting concept. Here's kind of the psychology behind it. Some behavioral episodes become so habituated that the child cannot modify or change that behavior until the whole thing is changed. So let's just play this out. So this guy comes into my office. Mom, there's a chain here. Mom comes in with him. Mom allows him to bring the device from the car. It's kind of a transitional object into the office. Mom goes into the therapy room with him. Now, you know, we've got different steps now of this behavioral chain. And then he gets to keep his device and come in and go back and forth out of my room. That's kind of how it started. And part of it was really purposeful because he wouldn't leave the car to come into the office. And the way to get him to leave the car was for him to bring that device in with him. And mom also had to come because I went out to try to get him and that wouldn't work. He wouldn't come in with his device alone. Mom had to come with him. So now we've got this chain that's developed, and it's happening every time he comes into the office. So these episodes and reactions form a chain of events that are predictable, right? The person coming into my office, there's very comfortable with it because he knew what to expect. And the outcome then is very negative if we change something. It's very, very punitive to them if we say you can't have the device when you come into the play therapy room. But what can work is to replace that device with something else. And it was a token. And that token had a different meaning for him. It was totally breaking down that chain so that something different could be interjected. I could interject the tokens, but I had to break the chain down. I couldn't let him come in with mom and keep the device and then start giving tokens for good work, because he would be on that device. He would have mom's neck with him. He wouldn't be achieving anything that I brought him into my office to achieve. So again, here's what we do to interrupt that chain. I gave him the tokens, which took the place. We sort of exchanged the token for the device. And then he knew that at the end of that chain of tokens, I shouldn't use the word chain, but at the end of that token board, he would be reinforced. So here's some things that you can do to interrupt that chain. I'm sure all of you now are thinking about something with your child or with the person that you care for that is a behavioral chain, because it just happens automatically. If you redirect or give a distraction, sometimes we even have a phone ring, and that's enough of a distraction, right? The sensory integration techniques use vibration, use a therapy ball, trampoline, brushing, rubbing on lotion. Those are all ways to interrupt that chain. So once they start that chain, you introduce this distraction. You introduce this sensory technique for calming. Here's something that we've used, which is kind of it goes on his pants and it's fidgets there. And so when he starts this chain, he gets this, I just clamp it on, and then he's got a device there or something there that he can fidget with. And it totally interrupts it. How about the environment, changing things? Maybe, teachers sometimes when the kids are getting sort of out of control will turn the lights off. That's kind of a way to interrupt that chain. Well, you can do the same thing with someone with Fragile X. Reduce the stimulation. Turn off the radio. Talk softly. So you're going to change something in that environment that's going to change. You're going to introduce a visual distraction. Maybe, like I said, the input of the lighting. And a lot of times when something is going on, if you just stop and don't talk and sort of lower your head, that will distract them enough because they're going to wonder, why are you doing that? And it's going to change then that chain. Introduce something novel. Music, video segment, tape TV program, some of them commercial. I have even done, again, YouTube and had it queued up so that one of the guys liked vacuum cleaners. And I had that queued up to the vacuum cleaner and I'd put it on and the chain was disrupted. They'd come on in, sit down. Maybe they were already in, but they'd sit down and we could start immediately. Important. You need to have all of your materials in place and ready to go, because if you interrupt the chain and you are successful at that, you better have something to get them going on, right? Because you're interjecting a new behavior to the old one that has habituated. So you have to have your ducks in a row in order to make this work. Now, giving compliments, that's another one that's a trigger for behavior. And I have heard so many individuals with Fragile X, children and adults, tell me they hate happy birthday. They hate the song. They don't want to hear it. They don't want to be in a restaurant where somebody is actually singing happy birthday or having happy birthday sung to them. And it triggers an emotional response. And what I've learned is that you're front and center. Everybody's looking at you. Everybody is giving you all that attention. And it runs the same vein as when we give compliments to people. And doesn't that seem so weird? Because that's a wonderful thing to do, right? It's a lovely thing to give somebody a compliment. With this population, it's not always effective because what it does is it triggers that reaction of being on the spot. So this guy is an interesting guy. I worked with him for a while. I think this was California. And I noticed that the more attention that I gave to him, the more he wanted to avoid me and escape.
Where are you going? Are you going home now? Let me get the back of that shirt. I want to get a picture. Slow down just a second because this is a very cool. It says, Eat at Joe's, Catalina Island, right? Let's see the front of it. What does the front say? It says, I gotta get close to that emblem. That says, eat at Joe's. That's pretty hot. And there's that cute guy right there. Ooh, man, is he strong. Oh, my goodness. You're lifting up that backpack. Is that a pirate's backpack? Let me get that again. That is so cool. Awesome.
So here is a way to engage him without giving him all that attention directly. We can talk about his backpack. We can talk about his shirt. We can talk about a number of things as long as I'm not asking him direct questions and giving him lots of compliments directly, or telling him, when I said that good looking guy, you notice what he did? He brought that up and he wanted to cover his eyes. So it's really important to focus on other things. Sometimes when I meet a new client and they're very anxious about that compliment or being on the spot or me talking to them directly, I talk about something like their shoes, or I talk about something that they're wearing. And that takes the emphasis and all of the attention away from that person to something that's an object. So it's an object that they can relate to, but it's not about them. So again, just a tip that can really help with that. Anxiety is huge. We know there's a lot of avoidance, there's shyness, there's a lot of worry, panic attacks, and trouble initiating contact. You remember the video that we showed of the guy that did all kinds of other things besides start the conversation. It's tricky. It's a big deal. Those of you that have heard my lecture on anxiety can refer back to it. There's a lot of good detail in that lecture, but this is simply, it's just part of the phenotype. It comes in on that gene, and what it really does is it causes lots of people to get stuck, to not be able to communicate, not be able to deal with what's going on. And we're hoping that today, after you see some of this, you can certainly understand ways to cope with that anxiety, because it's a big trigger. And I always tell people, how would you like to live with that constant it's a surveillance. I mean, always looking around, always worried about what's coming next, always worried about the environment. And you're trying to preserve this person, this organism right here. There's some pretty crude behaviors that result from that preservation, because we're talking primal, aren't we? We're talking something that is really, really significant and not easy to control for. So again, the antecedents, we've talked about this. This causes the anxiety, the change in personnel, changes in schedule, too much input, etc. Also, staff being afraid or intimidated by the person with Fragile X. They feel that through their skin. So once again, we really need to understand how these things trigger the anxiety. Responses, it's that hypervigilance. It's that increased heart rate. It's the cluttering of the fast speech. And you witnessed in the video the guy that was having the panic attack. Sometimes we see that when they hear yelling, when somebody's aggressive around them, when they're embarrassed, when we draw attention to them. A lot of times an argument, let's say parents maybe, and not even a big argument, just having two sides of a conflict. When they observe that, they oftentimes become very anxious, and that becomes a trigger for a behavioral episode. So again, just sort of being careful about that and watching sort of how that works. I always try to do the side dialoguing or doing something else in a different, having your conversation somewhere else where it's not being observed by the individual with Fragile X. That helps. These people have told me in different sessions what it feels like when they're anxious. They get cranky, they lie more, they tell big whopper stories, they might avoid things, sometimes pick at their skin and scabs, laughing very inappropriately. The girls tend to do that. So again, when they're anxious, there's lots of behaviors that follow. So what do we do? What are the strategies? How can we increase positive behaviors and decrease negative behaviors? Well, we already know that when you give them choices, and I think this is critical, this is for a school age person, but you can give choices to all ages of individuals with Fragile X. If you think about their lifespan and you think about what's gone on with them in life, so many decisions are made for them because we simply feel that they're not capable of making those decisions. And many times they're not mature enough. Their cognition doesn't allow for them to sort out all the details of making a decision. So a choice is a big deal for them, big deal. So what can we do? Well, it's pretty easy. If we're setting up the day and we don't care what they're doing really in terms of the order, let them put it together. Let them have a choice of what they're going to do first, what they're going to do next, whatever. Sometimes we have to follow a schedule at a school because the rest of the school revolves around that schedule. But let's say there's a time for free time or something. They can choose from this list of things they can do during that time period. So there's always ways to tweak that to give them some choices. Another thing they really love doing, and I think it's very calming, is checking off things that they've accomplished. So again, even though they know their day or they know the task, let them have sort of some order to it. And as soon as they do one part of that task, check off the next one. This creates this positive sort of existence, so to speak, because everything's predictable. They feel really good about checking these things off. They feel as though they've accomplished something, and they take with them that feeling of success and positive well-being to the next thing that they're going to be doing. So again, creating that ability to have them feel good about what they've done. What do we do for support at home? Well, I always advocate making it a comfortable place, but in that process, and we get this wrong sometimes, that because we've made it comfortable, we just let anything happen. We need structure. You've got to infuse structure into that comfortable environment. So if there's a way to have a schedule where he can have a choice of a couple of things he does after school, that's fine. Or if there's a chance to relax and then the schedule says this is next with some structure. So you've got some structure built in. The visual schedules are so important. I have so many parents that tell me, but he knows the schedule. But what happens when you forget? What happens when you're anxious? What happens when that brain just has a fog? I always tell the story about I have my iPad there with my schedule on it. And sometimes I think I know what the day is supposed to look like, but thank goodness I have that to go back to. It's very reassuring. You need places for sensory breaks. You need places to teach regulation. And this is for adults as well. In facilities where we have group homes here, they often have a treadmill. They often have a game room. They often have a place where they can sort things. They can do a job for the group and for the group home. So they might sort out the silverware. They might put some groceries away. Those things cause regulation. They're predictable. They're a job. It's something that makes them feel good. Their well-being has been supported. Also, workstations, depending on the age of your child, you can set a lot of things up. They can sort laundry, and then give them a token. And then they can sort the silverware, give them a token. Maybe they can put things away in their bedroom, give them a token. Those are all really important things to have in place. And then this is critical, limit the time on screens. It's really an epidemic here in the States. And that's not just for people with Fragile X. We've got a lot of kids that are addicted to those screens, and they do not go outside. They don't breathe fresh air. They don't move their bodies. They don't do anything that's stimulating other than that constant input. They're not having to output any verbal. And that's really, really becoming a problem. So set up those little jobs and try to do something with them that's cooperative. Predictability, again, a schedule. We've talked about that. Here's another thing that's very calming, sorting things out and doing things that contribute to the welfare of the home. I always get this question, should we tell them ahead of time if we're going to do something? Because sometimes when I do that, he'll obsess over it, and all night long he won't sleep and he wants to talk about what we're doing the next day. and I think it's bad for him. And you know what? Sometimes it is. I think there are a certain subset of these guys with Fragile X that need the predictability. There's another subset that really does just as well if you spring them on them the day that it's happening. And your client, your child. And again, I think this is something that you have to plan out with them. If it's something that is going to upset them all night long, in the morning, you can have a side dialogue with a coworker or your husband or whatever, your partner, and you can say, today we're going to go do X, Y, and Z. And that means that James is going to have to do this first. If you have those side dialogues, they're hearing every word of that, but it's not nearly as difficult and anxiety provoking as, well, we're going to pack it up. We're going to go do this. Go ahead, go in your room and get it. It really helps them have a chance kind of for that second generation to process, second generation of information to process and to understand what's happening. So I would say, depending on the person that you have in your family or taking care of, you'll know what to do and what's going to work. A lot of times we'll do this and then this. This is a way to get them away from that preferred transition into something that's non-preferred. So we got to do this first, and then you have time on the computer. Again, the question mark we've talked about. The tokens are they really are a big tool in my toolbox. I use them all the time. I either do tokens like this or money, or I do things that are high interest. Sometimes I'll have 10 if I want to delay the reinforcement and try to build that stamina for the task. Other times we'll preload and get something good going right away. So again, that can summon attention and then get them to the task of appropriate and adaptive behavior. This can be a really good thing to use in some social skills building and those kinds of things, so that you can keep track of the back and forth and how well somebody's attending to what somebody else is saying. Again, same thing. And here's the schedule for the evening. Breathing, reduce the likelihood of the behavioral outbursts. We've all talked about that many times. How you smell that rose and you blow out the candle. Taking deep breaths, nothing new here. Calming down. We use this a lot to sort of process those behavioral episodes. So again, if we structure things in a way that's successful, they're going to tell you that particular situation made them feel happy, right? That we can process and go back to that. Sometimes we need to identify feelings. I think this is particularly good because sometimes it's not just an emotion. It's actually, I'm hungry. And so I'm acting out because I'm hungry, or I'm thirsty, or I don't want to wait any longer. Those are things that are real important to take note of. And sometimes we'll see some behavioral episodes because they're sick and they don't tell us. Sometimes they pull at their ear and it turns out they have an earache. Well, no wonder they've been irritable. So these are all parts of that foundation that you need to think about before you really look at that behavior. It's serving a function, and it could be communicating that I'm sick or that I'm hungry. This is something that I've developed lately, and it's really worked beautifully. After the pandemic, I couldn't see a lot of people in person. And so even though we were considered first responders as behavioral health workers here at the office, I was seeing some of the individuals that just couldn't work on the screen, but there were some that could. And we started looking at ways that they could tell me more about their feelings and what they like and dislike, what makes them, we could change this to sad and happy. I mean, there's a lot of ways you can change these boxes. This kind of goes to that information we were talking about, checking things off, putting them in a box. It's tangible, it's concrete. So here's some things that came out of just our conversation, therapy, input from parents about what the triggers were for some maladaptive behaviors. And so I have them pick a color. So this one, let's say they pick blue. This one, they pick black. They'll pick the colors, and they have colored pencils there. Print this out, or we share a screen and we do it together, and I'll go ahead and circle whatever. Loud voices. Oh, I don't like that at all. Really? How come? I get so much more out of this kind of conversation because it's directed towards something that's sort of tangible, but it's not right to his face. Like if I said to him, do you like loud voices? He'd say no. Anybody would that I work with, they'd say no. Well, why not? Well, that isn't going to get it. I mean, you're just not going to get anything out of that. But when he circles this, oh man, you don't like loud voices. All of a sudden something comes up. Yeah, last night my nieces were in the car and they started singing a song and it got really loud and I got really mad and I pounded something in the car and I got in big trouble. I never got that from our therapy session or anything else. So I would highly recommend something like this. If they don't read this well, you can read it and they can tell you what color to make it, and it works just as well. I think it's really an interesting way to sort of get them focused on something that is in fact their life, because he bought a sword on Amazon and that was not a good idea and it had to be taken back. But that became an issue that we confronted in therapy. I just think these are really great ways to change some behaviors and to identify what really is bad and what's good to them. Again, how big is your feeling? Anita, you'll probably be listening to this, maybe, I'm not sure, she's in New Zealand, but she helped me develop this, and we decided that the dice was a better way to kind of quantify what it looked like rather than numbers, because sometimes, you know, our guys don't do real well with numbers. And then the emojis, because everybody knows those. So again, I put a worksheet together with some things that happened maybe during the week, and I'll say, oh gosh, got in trouble for screaming. Oh, that was a 5. Okay, that was that bad. That was a 5. Went to the grocery store with mom. It was okay. It's all right. It's a 1. I even give them the name of a coworker or somebody that they work with. That's a 5. And the other day that did happen, because this guy was not too happy about a coworker and started acting out. But see, what I got out of that was the reason that he called strangers bad names is because he didn't like the coworker that was there. Okay, we can't change the world for him, but we certainly know where we can start, right? That coworker and he maybe don't hang quite so much together. We want to teach some form of regulation, and that's very hard to do, but this kind of brings you to that point where you can look at how can someone get through a difficult situation where we know the environment is going to provoke certain maladaptive behaviors or acting out behaviors. How can we help teach those supports so that that person can integrate those supports into their life as they progress through life? So this one is taken from a school cafeteria. Obviously, we can have cafeterias anywhere. We can have break rooms when people are older. And in this particular case, the lunchroom was very anxiety provoking, was very sensory provoking, was very hyper. It was a hyper arousal going on with this situation. Anytime that the student would enter, he would get hyper aroused. So we decided, because eating alone is not being included, eating alone does not build social skills. And so we began the process of teaching this before, during, and after strategy. And the before is heavy work. It's bringing something in to the cafeteria that's needed. If it's a break room, if it's even a job where you can do something heavy before you go into the break room, that's important, because that then helps with that trunk security stabilization, and it helps really get that person to a point where he can then enter that situation. Okay, now while he's there, he's using earbuds. And in the school, some of the kids were not, they really weren't allowed to do this at this school. Other schools, I've seen them do that, but that's okay. This was an accommodation for this individual, and he could tune out some of what was going on. There was a specific time during that period where there was social interaction going on. And at that point, he was sitting on the end. He had an accommodation where he could sit. And it was around less noisy, sort of, you know, not the machines, not the serving up of the food and those kinds of things. And that's when that 5 minutes of interaction took place. The rest of the time, he was able to use quiet music and have his pods in. Afterwards, then he did a lot of deep breathing and some of those exercises that we went over earlier. The idea behind this is that's a visual support that can give an opportunity, give him a chance to participate in an activity that includes him. It's very important for his inclusion, but he has some alternatives. He has ways to self-regulate. And just knowing that really helps with the anxiety. I've got something that works. Again, the worries grow bigger when we focus on them. Kind of looking at ways to shift attention to something else, interrupt the worry cycle, calm our minds. A lot of times it's breathing. Sometimes it's blowing bubbles. Sometimes it's blowing a feather. There are a lot of different ways to kind of get that breathing going so that we have a calmer mode. I do want to express to you that I've learned a lot about even lower functioning, more impacted individuals with Fragile X. Their feelings are really there. I mean, they have the same kind of feelings as people that are less impacted. It's just that they have no way to show us what's going on with those feelings except to behave in a way that sort of communicates, I don't like this. You're hurting my feelings. I'm embarrassed. They do get embarrassed. And oftentimes that's a thread that runs through that whole continuum related to those with Fragile X syndrome. When they make a mistake, they hate that. They get very embarrassed. That's why they wad things up or they throw things away. It's really important. We want to make sure that we introduce some of these shifts and these sorts of strategies away from the worry, away from the embarrassment, away from what they're thinking about, so that their brain stops sending them that emergency code or signal that something's wrong, and then they can calm down. Again, accommodations for any social anxiety. We've got all kinds of ways to do that. Sometimes the device is not so great because it sort of deters them from the social activity, but it is also a way to sort of desensitize them and get them into that situation. I think I've told the story many times about the sunglasses and how I allow that in my therapy sessions because sometimes that just delivers a little bit of a shade there or some filtering so that it's not so direct.
Marcia, I hope that you can see some of the thank yous in the chat box and how much you're valued.
Wonderful.
So
Wonderful.
Thank you so much. And enjoy the rest of your day, everyone. Enjoy your evening, Marcia, because it's
I will.
6 o'clock with you, and look forward to seeing you all again very soon. Stay safe.